What if I told you that one of the most effective ways to improve your blood sugar control isn't found in a pill bottle, but in something so ordinary that most people never give it a second thought? How and when you drink water. I know how that sounds. Almost too simple to be true. You might be thinking, I've been drinking water my whole life. How could that possibly affect my diabetes? Or maybe you're skeptical because you've already tried so many things that were supposed to help and didn't. Supplements that promised cure, diets that were exhausting and impossible to stick with, advice that sounded reasonable but never showed up in your glucose readings. Stay with me for a few minutes because what I'm about to share has created real, measurable improvements for hundreds of people I've worked with. These aren't textbook examples. These are real men and women, mostly in their 60s and 70s, who were doing everything they were told and still struggling. Today I'm going to show you how strategic hydration, specifically when, and how you drink water can improve insulin sensitivity by as much as 40%. I'm talking about people who never miss their medications, people who follow their meal plans carefully, measure portions, check their blood sugar multiple times a day, walk every morning and still see unpredictable numbers. They're exhausted. They're anxious every time their A1C results come back, and they're frustrated beyond words. Many of them have been fighting this battle for decades. They've spent money on special diabetic foods. They've eliminated foods they genuinely enjoyed. They've followed every instruction their doctors gave them. And yet they feel like they're failing even though they're trying harder than almost anyone else around them. Over the years, I've learned something important. Some of the most powerful medical changes aren't complicated or expensive. Sometimes it's the basic things we've completely overlooked that produce the biggest, most consistent results. Recent research from major medical institutions has shown something remarkable. Drinking water at specific times during the day can dramatically improve how efficiently your body uses insulin, whether that insulin comes from your own pancreas or from medication. But this isn't just about drinking more water. It's about timing, temperature, consistency, and what you combine it with. Small, intentional changes can lead to surprisingly large improvements in blood sugar stability. Before we go any further, tell me, where are you watching from right now? Drop your city or country in the comments. I love seeing how far this message reaches, and it reminds us that blood sugar challenges affect people everywhere. Now, let me be very clear about something. This is not about replacing your medication or ignoring your doctor's advice. This is about supporting your body so that everything you're already doing can work better. To understand why this works, we need to talk about what actually happens inside your body as you get older. After the age of 60, several changes occur that make blood sugar control genuinely more difficult even if you're doing everything right. First, your cells gradually become less responsive to insulin. Insulin still shows up, but your cells don't respond as efficiently when it tries to move glucose inside for energy. Second, your pancreas doesn't produce insulin as effectively as it once did. You're working with less of a hormone that's absolutely critical for blood sugar regulation. Third, your kidneys don't clear glucose from your bloodstream as efficiently, which allows excess sugar to linger longer than it should. And here's the piece most people, and even many healthcare providers, completely miss. As you age, your brain's thirst signal becomes weaker. This is crucial. You can be significantly dehydrated without ever feeling thirsty. Your mouth may not feel dry. You may not feel uncomfortable at all. But at the cellular level, dehydration is already interfering with blood sugar control. Even mild dehydration, just 2% below optimal levels, can raise your blood glucose by 10 to 15 points. That's enough to turn good control into poor control. enough to explain those confusing morning spikes or afternoon highs that seem to come out of nowhere. Let me share a real example. A patient named Rayan came into my office at age 68. I could see the frustration on his face before he even spoke. "I don't understand what I'm doing wrong," he said. "I eat carefully. I measure everything. I take my metformin exactly as prescribed. I walk 3 miles every morning. I've cut out sugar and white bread completely." He pulled out a small notebook filled with blood sugar readings. Some mornings it's 145. Other mornings it's 185. Yesterday it was 162. Today it was 178. Same breakfast every day. Same oatmeal. Same portion. But the numbers are all over the place. His wife quietly added, "He tries so hard, but his A1C just keeps climbing from 7.1 to 7.9 this past year." We reviewed everything. His diet was excellent. Medication timing was perfect. Exercise was consistent. On paper, everything looked exactly right. Then I asked a simple question. "Walk me through your morning routine from the moment you wake up until breakfast." I wake up around 6:30. I check my blood sugar right away. Then I make coffee and drink it while reading the news. Around 7:30, I make my oatmeal and take my medication with a glass of water. I paused. "When do you drink plain water?" He looked genuinely confused. "When I'm thirsty, I guess, or with my pills." That was the missing piece. Rayan was going 9 hours, 8 hours asleep and another hour awake without drinking any actual water. By the time Rayan sat down to eat breakfast, his body had already been in a slow state of dehydration for nearly 9 hours. During that entire time, his blood had gradually thickened. Glucose had become more concentrated in his bloodstream, and insulin was already struggling to do its job efficiently. We didn't change his medications. We didn't change his meals. We didn't increase his exercise. We made a few very specific changes to how and when he drank water. Every morning, before coffee, before breakfast, before anything else, Rayan drank a full glass of warm water with a tiny pinch of natural sea salt and fresh lemon juice. About 15 minutes before lunch and dinner, he drank a smaller glass of room-temperature water. Throughout the day, he carried a reusable bottle and took steady sips instead of drinking large amounts all at once. 2 weeks later, he called my office. His voice sounded lighter, almost excited. "My morning readings have been between 125 and 138 every single day this week," he said. "That hasn't happened in over 2 years." A month later, his average fasting glucose had dropped by 22 points. No medication changes, no dietary changes, just hydration timed correctly. At his follow-up appointment, he smiled and said, "I honestly thought you were a little crazy. Water seemed too simple to matter, but my glucose meter doesn't lie." Before I teach you the exact method I use with my patients, I want to explain the 3 most common hydration mistakes I see every single day. You're almost certainly making at least one of these right now. Mistake number 1, waiting until you feel thirsty. Thirst is not an early warning signal, it's a late alarm. By the time you feel thirsty, dehydration has already set in. Your blood has thickened. Glucose concentration has increased. Insulin is already working harder than it should. Think of your blood like a river carrying glucose to your cells. When the river is full and flowing smoothly, glucose moves easily where it's needed. But when the river runs low, it becomes thick and sluggish. Glucose gets stuck, building up in the bloodstream instead of entering your cells for energy. Mistake number 2, drinking too much water all at once. Many people go hours without drinking anything, then try to catch up by drinking a large glass in one sitting. The problem is that your body can only absorb about 1 cup. roughly 200 to 250 milliliters every 15 minutes. Anything beyond that simply passes through to your bladder without hydrating your cells. It's like watering a houseplant. If you dump a full bucket on it all at once, most of the water runs off, leaving the roots dry. But slow, steady watering allows the soil to absorb moisture properly. Mistake number 3. Drinking ice-cold water, especially in the morning or around meals. Cold water causes your blood vessels to constrict. Narrow vessels make it harder for insulin to reach the cells that need it most. Room temperature or slightly warm water keeps blood vessels relaxed and open, allowing insulin to circulate more efficiently, especially during times when your body is actively processing glucose. Now let me show you the system I use with my patients. I call it the H3 method. The H stands for hydration. The first 3 represents 3 key timing points during the day. The second 3 represents 3 essential elements that make this method effective. Let's start with the timing. Timing point number 1, first thing in the morning. This is the most important hydration moment of your entire day. As soon as you wake up, before coffee, before food, before checking your phone, drink 1 full glass of warm water, about 12 ounces or 350 milliliters. Add 2 things. A tiny pinch of natural sea salt, just what fits on the tip of a knife, and the juice from about half a fresh lemon. After 8 hours of sleep, your body isn't just low on water. You've also lost electrolytes. That small amount of sea salt provides minerals like sodium, potassium, and magnesium that help your cells actually absorb the water instead of flushing it out. The lemon provides vitamin C and creates a mild acidity that helps stabilize your blood sugar response to your first meal. This simple morning habit also calms your adrenal glands. These glands release cortisol, a stress hormone that peaks in the morning and signals your liver to release stored glucose. Proper hydration helps blunt that unnecessary glucose release, preventing those stubborn morning spikes. I had a patient named Sarah, 72 years old, who had lived with type 2 diabetes for 14 years. Her biggest frustration was her morning numbers consistently 165 to 175, even with careful dinners and acceptable bedtime readings. We made just one change. Warm water with sea salt and lemon first thing in the morning, at least 20 minutes before coffee. 3 weeks later, her average morning reading was 128. Same medications, same routine, just a different start to her day. I feel different when I wake up, she told me, clearer, less foggy, and that morning number gives me confidence for the rest of the day. Timing point number 2, before meals. About 15 minutes before lunch and dinner, drink 1 small glass of water, roughly 1 cup. This prepares your digestive system and slightly dilutes stomach contents, slowing how quickly carbohydrates enter your bloodstream. Slower absorption means insulin can keep up, preventing sharp spikes. Studies show this simple habit can reduce post-meal blood sugar spikes by up to 20%. Timing point number 3, during physical activity. If you're active for more than 20 minutes walking, gardening, housework, drink water during the activity, not just afterward. Aim for small sips every 15 minutes. This keeps blood volume stable and prevents exercise-related blood sugar swings. Now let's talk about the second half of the H3 method, the 3 essential elements that make this approach actually work. Element number 1, temperature matters. Room temperature or slightly warm water is ideal, especially in the morning and before meals. Roughly 22 to 24 degrees Celsius, or about 72 to 75 degrees Fahrenheit. Cold water isn't harmful, but warm water keeps your blood vessels relaxed and open. This allows insulin to circulate more efficiently and reach your cells with far less resistance. Over time, that small difference adds up to meaningful improvements. Element number 2, minerals matter. Water alone isn't enough. Your cells need minerals to properly absorb and use the water you drink. That tiny pinch of natural sea salt in your morning water provides essential electrolytes, sodium, potassium, and magnesium in a balanced form. Avoid refined table salt. It has been stripped of its trace minerals. Choose unrefined sea salt or Himalayan pink salt, which still contain the elements your body actually requires. Element number 3, consistency. Your body thrives on routine. Drinking water at the same times every day helps regulate your metabolism. Morning hydration, pre-meal water, and steady intake throughout the day create predictable blood sugar patterns instead of chaotic fluctuations. There's one additional step I recommend. About 1 hour before bed, drink a final glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate mixed in. Magnesium plays a critical role in insulin function, and most adults over 60 are deficient. Taken at night, it supports deeper sleep and helps stabilize blood sugar overnight. Now, how much water do you actually need each day? Here's a simple guideline. Take your body weight in pounds and divide it by 2. That number equals your daily water intake in ounces. For example, if you weigh 160 pounds, your baseline is about 80 ounces per day. If you exercise or spend time in warm environments, add 1 extra cup for every 20 minutes of activity or heat exposure. An easy way to check hydration is urine color. Pale yellow, similar to lemonade, is ideal. Dark yellow means dehydration. Completely clear means you may be overdoing it. For practicality, use a reusable water bottle that holds around 24 ounces. Fill it 3 times per day, morning, midday, and afternoon. Keep it visible. Visual reminders work far better than memory alone. What should you expect when you start? During the first week, you may need to urinate more often. That's normal. Your body is adjusting. By week 2, this usually settles. You may notice morning blood sugar readings drop by 10 to 15 points. Not dramatic overnight change, but steady improvement. By weeks 2 to 3, energy levels become more consistent. Afternoon crashes diminish. Post-meal numbers become more predictable. By week 4, A1C levels often begin trending downward. But what I hear most often is this: I just feel better, more like myself. This doesn't cure diabetes. It doesn't replace medication. It supports your body so everything else works the way it's supposed to. If you're on diabetes medication, do not stop. If you have kidney disease, speak with your doctor before increasing water intake. If you take blood pressure medication, monitor carefully. Hydration can naturally lower blood pressure and may require adjustments. Let me tell you about Maria. She was 74 and had lived with diabetes for 19 years. Multiple medications, strict diets, education classes. Her A1C had climbed to 8.6 and insulin was being discussed. "I feel like I've failed," she told me quietly. She barely drank water, coffee in the morning, tea in the afternoon, very little plain water. She never felt thirsty. We started the H3 method together. 6 weeks later, she walked into my office looking younger. Her numbers had dropped from an average of 185, 205 to 100, and 45, 165. Her doctor reduced one medication. Her energy returned. She started gardening again. 3 months later, her A1C was 7.3, all from something that costs almost nothing. That's why I share this. I challenge you to try the H3 method for just 14 days. Follow it exactly. Track your numbers. Pay attention to how you feel. If you notice improvement, make it your new normal. If you made it to the end of this video, type "I watched till the end" in the comments. Are you going to try the H3 method? What's your biggest struggle with staying hydrated? Share this with someone you care about. And if you haven't already, subscribe and turn on notifications so you don't miss future videos on blood sugar control and metabolic health. Thank you for being here. Small, consistent changes create real results over time, and I'll see you in the next video.